All right, welcome back. In health news this morning, certain medications can actually have an effect on your body in a variety of ways. Dr. Harry Croft, psychiatrist here in San Antonio, is here to talk about a new study that he's conducting. And it's interesting because we're calling it a sex study, because ultimately what you're trying to do is get people that are on certain types of medications to find out if it's affecting their libido, both men and women, right?
Right. So antidepressants, things like Zoloft, Paxil, Celexa, are very effective in treating depression.
Okay.
But as a side effect, they can cause both decrease in desire as well as decrease in performance. And that occurs in both men and women. And it's a problem. In fact, it's the #1 reason, sexual dysfunction, that people stop their antidepressants too soon. So when they stop it too soon, it's not at the beginning. At the beginning of the depression, when they start taking an antidepressant, who cares about sex? You feel so down, you don't care. But then later on, the antidepressant works, you feel less depressed.
Okay.
And now all of a sudden, people have this sexual problem and they say, who needs this grief? And they stop their antidepressant early. When they stop it early, their depression comes
Well, Dr.
back.
Croft, it's interesting because a lot of people get on antidepressants because they were already depressed before that and they had lost their sexual desire because they were depressed. Then you try to help them with this medication and then it takes away one of the parts that they're hoping to get back. So you're hoping that a new product that you guys are looking at and wanting studies for would actually change all of that, right?
So there's a new antidepressant that's being developed. It's not on the market yet. But the good news seems to be that it helps depression, but it also does not cause sexual dysfunction, may actually improve it. And that's the drug we're studying. So what we're looking for, Monica, are people that are on an antidepressant, Celexa, Zoloft, or Paxil.
Okay.
They're doing well, their depression is better, but they're having this sexual dysfunction, and they're willing to participate in a study to see if this new medication works better.
Now, I know a lot of viewers out there are probably embarrassed. They don't want to come and do a study like this. Tell them that, is it a comfortable environment for them? Kind of explain that for people that might be watching right now.
So, for 30 years, I've been taking care of people with sexual dysfunction. It's a very comfortable environment. The people they talk to on the phone, it's a woman, Deanna. She's wonderful. We make it very easy for people to talk about what we know is a very sensitive subject. And of course, the study is free. And they get paid if they get into it for time and travel, and they don't need to have any sort of insurance.
Wow. So all of that, and then you get to try out this new antidepressant that could actually help you with your depression and also help you with your sexual dysfunction, men and women. You want to call the Croft Group Research Center. Their phone number is 210-692-1222. It's 210-692-1222. It's extension 103 if you want to be a part of this study. And we appreciate you being here this morning and letting us know.
Always a pleasure.
And we appreciate all the work that you're doing in our community, Dr. Croft.
You.